frozen shoulder, or its other term, adhesive capsulitis, is a relatively common condition affecting typically women between ages of 40 and 60 that comes on for no good reason. Frozen shoulder is classically described in 3 phases. The first phase is known as the freezing phase. Clinically, patients complain primarily of pain at that point and not so much stiffness. The second phase is the frozen phase, and at that point, pain actually often diminishes, but the shoulder can be markedly stiff. Patients will eventually enter the thawing phase. And in many cases, frozen shoulder or adhesive capsulitis is a self-limiting condition, meaning that eventually it does get better, sometimes completely on its own. But that process can take sometimes up to 2 years or more. If you can make that diagnosis early, which can be tough, you may be able to avoid that process of stiffness. I would recommend, as a first step, seeing your primary care doctor and discussing the problem. And at that point, the next step may be referral to physical therapy or even evaluation by an orthopedist. At the first visit, a patient can expect, first of all, and perhaps most importantly, a thorough history. That's critical to making an accurate diagnosis. Secondly is a thorough physical examination of the shoulder. And generally, between the history and the physical examination, you should have a good sense of what's going on. So in terms of treatment, for patients who are in that initial freezing phase, inflammatory phase, or having a lot of pain, anti-inflammatory medication can be helpful. Gentle, and I think the key is gentle physical therapy, either under the direction of a skilled physical therapist or sometimes even just self-directed at home, can be beneficial to help maintain range of motion. We also routinely employ the use of intra-articular corticosteroid injections, which is an injection of corticosteroid that's done directly into the shoulder joint. So if a patient is not getting better over a certain period of time, they may be a candidate for some type of intervention. A surgical procedure is actually performed. It's called an arthroscopic capsular release. So the procedure is done arthroscopically through small incisions. And what's actually done is, under arthroscopic visualization, the stiff and fibrotic capsule is actually cut and released. Bottom line is, you have shoulder pain and it's affecting your daily living. I think it's time to get checked out. Initially, perhaps by your primary care physician, but certainly if the pain's persisting and it seems like something is going on and it's not just getting better on its own, it may be time to get checked out by orthopedics.